Well, we know that we're just about ready for summer. Mentally, it seems like we're really ready because of the really difficult winter we had. Physically, though, that may be another story. Our friend Dr. Stephen Davis is here to help us out. Dr. D, it's great to have you with us.
Nice to see you.
Yeah, you're saying that we have an opportunity to get a bikini body fairly quickly.
Yeah. I know.
Give us an overview.
Right around January, everybody starts making New Year's resolutions, and they hit the gym and start watching what they're eating and exercising. But it's about 6 weeks away before summer comes around. So there are a bunch of little things you can do still to get your body ready for summer.
Okay, so let's first talk about the first body part, and that would be the bust line on women.
Right.
Now, you say it doesn't have to be bigger,
right,
but it can be better. And,
you know,
we have a before and after picture that Dr. D brought along. Go ahead, explain to us.
One of the things, I guess, about today's whole segment is you don't necessarily have to think about getting something bigger to make it better. Just like when we talk a little bit later about arms, when we're talking about the breast, a lot of women just want to have their breasts made perkier and more lifted. And one of the things we can do is put little breast implants in, and those breast implants actually take up the excess skin so the breasts look fuller, and they also look perkier without actually having to make them look very large.
And the recovery process for that is fairly...
Probably about a week to 10 days before you're really back to doing everything. But the good thing is you can be on the beach the next day because you don't have anything to do except wear the bikini or whatever.
Right, and
so
really
it's good.
Looking fabulous. Okay, now there are some other women who would like to be able to have a little more curve to their backside.
Right.
A lot of us are trying to make it look a little bit trimmer, but there are others who like to have it look a little curvier. So what are you offering for that?
Again, same concept. A lot of times, even with weight loss, the butt just doesn't seem as round and as full as it used to. So we can take a little bit of the fat that we may be liposucking from somewhere else and transfer it into the butt to just give a better shape and a tighter, lifted look to the butt. Very simple, and again, something like that's an office type of a procedure where we can really harvest the fat from somewhere where you don't want it and kind of transfer it to where you do want it, which in this case happens to be the butt.
Okay, doesn't it hurt though? Isn't there some recovery time with that because you're really sore?
The main thing is you stay off of your butt, so that's another good thing. If you try to stay off your butt, the good news is the fat stays there longer, and the real pain in it is really more about resting on your butt. So you can lean on your sides and things like that, and it's a pretty quick recovery.
Right. Now, how about arms? There are a lot of women who feel like they're waving long after they stop waving. And we also have a before and after picture of that, Paul, if you could put that up.
There it goes. Well, we're using a brand new procedure called the Body Tight, and I actually brought the instrument with me to show you. But this is a perfect example of what we're talking about trying to make a shape or more tone. Most women aren't looking to try to get their arms made larger. They really want to get it shaped and toned. And that's kind of the same concept with the breast and the butt. We have a special procedure that's called the Body Tight, and it's a great way of not only liposucking the fat out from an area, but also heating up the tissues so that the skin actually starts to shrink. So instead of having big arm lifts and thigh lifts and even a tummy tuck, a lot of patients now, this is the option for them.
So you're going to shrink wrap your arms, is that what you're telling me?
That's exactly right. Well, that's a good way of saying it. That's exactly what we're doing. We're heating up the tissues with a radio frequency device that goes inside and a little transducer that sits on the outside of the skin.
Okay, and then you are bikini ready. Dr.
Bikini ready.
Thanks very much. Always a pleasure to have you with us. And so we have for more on the procedures and also Davis Cosmetic Plastic Surgery, you could go to cbs3.com/talkphilly.